So once these diseases are detected, the main job of the countries is to assess, report, and to respond. So detect, assess, report, and respond, so that this disease won't spread beyond the community which it is localized to. Okay, like for example, if COVID had started in India and it would have been recorded as fever of unknown origin, right? Fever of unknown origin. There'll be more cases, and IDSP will detect that there has been too many cases of a fever of unknown origin in this area, we have to do something. So they'll conduct an assessment. And when they conduct assessment, they're going to report and respond. And if they find that it is problematic and it cannot be controlled and it's going to pose a danger to other countries, they have to report through the international health regulations to the WHO. Okay. So this is what should have happened in China. So the IHR is binding to 196 countries. Okay, they have to. It's legally binding. If they fail to report, they're going to get penalized. Okay, so this is what IHR is. So it's just basically a legally binding agreement between the different nations that if there is a spread of disease in that area, which is posing a threat to the public or that it might have a danger of crossing borders, they're going to report it to the World Health Organization, so that they're going to take active precautions to inform the other countries also about an impending threat. So now what is this PHEIC? This PHEIC is Public Health Emergency of International Concern. So if any disease falls under this definition of PHEIC, which means a disease which is happening, like for example COVID, it's an extraordinary event, right? Which constitute a public health risk, which is to other states, which can spread through international borders and will potentially require a coordinated international response. So COVID fit the definition of a public health emergency of international concern, so it was labeled as such early in 2020. So this is how the PHEIC will be notified through the IHR. So through the surveillance system of each country, like in India we have IDSP. If we have any cases of smallpox, even one case of smallpox also it has to be notified. If we have a case of polio or human influenza or SARS, it has to be notified. And any event which is a potential threat to public health has to be notified. They're going to ask the question whether this public health impact is serious. If the answer is yes, you have to ask another question whether it's unusual or unexpected. And if the answer is still yes, then this event or that disease has to be notified to the WHO under the IHR. Okay. So see, look at what happened to COVID-19. These are the diseases here first which have been declared by the WHO as public health emergencies of international concerns in the past few years. Okay. So this is what happened to COVID-19. The first case was detected in China, in Wuhan in 2019. And it was declared as a public health emergency only in January 30th. So it took them 1 whole month to even declare, but WHO took 1 whole month to declare this as a PHEIC. And it was only in March 11 when WHO declared it as a pandemic. Okay, that's why people want to penalize WHO for not taking action immediately. Okay, even after knowing that there was a rare case of pneumonia that was happening in Wuhan, which can be a threat to international border. They did not do anything, and it took them a month to even declare it as a PHEIC. So this is IHR and PHEIC. So if you get a short note on this, you can just tell what is IHR, when it was formulated, then what are the diseases which are classified as public health emergency concern. You can talk about the flow chart, the different countries which are being bounded by the international health regulations, and then you'll get 5 marks. Okay. So you can give an example of coronavirus, since it's the most recent pandemic that has happened. Now, what about World Health Organization? So this World Health Organization might come as a short note. So these are the regional offices of WHO. So somebody might ask you in the exam, how many regional offices are there? So there are 6 regional offices of the WHO, and we belong to the Southeast Asia region, and the headquarters is in New Delhi. So you have to remember at least where your region belongs to. So we belong to the Southeast Asia region. So this is the contributors to the WHO as of 31st March 2020. So United States contribute about $115.8 million. So when Donald Trump last year, he said he's going to hold back the sanctions, so it really hit a blow, okay, against the World Health Organization. There has been a lot of controversy last year that the WHO has lost its integrity because how it has handled the COVID pandemic, okay. So this is the 3 organizational structure of the WHO. So if you get a short note on WHO, you can talk about when it was founded, about World Health Day, about how many members are there, how many associate members are there. You can talk about the different regional offices and the organizational structure, and easily you can get 5 marks. Okay. So this is another international organization which is important, the UNICEF, okay, United Nations International Children's Emergency Fund. So the UNICEF, as the name suggests, it caters only to the social problems that are plaguing children. So these are the things that it covers. Okay, it covers adolescent development, child protection, children uprooted, children with disabilities, communication for development, environment and climate change, and gender equality. So it caters only to the needs of children and the social injustices that are happening to them. So UNICEF, the headquarters is in New York, WHO is in Geneva. So UNICEF also has a different organizational structure compared to the WHO, its own unique organizational structure, but it is part and parcel of the United Nations. So this is the mission statement of the UNICEF. Okay, it advocates for the protection of children's rights to help meet their basic needs and expand their opportunities to reach their full potential. So this is a bit complicated, so it's okay if you don't remember. Now, this is, can anybody tell me this is the sign for which organization?
Red Cross.
Yeah, it's written in the slides, right? Red Cross. So how did the Red Cross came to be? So everybody knows when they see this sign that it is the sign of the Red Cross, okay, Red Cross Society. So World Red Cross Day is celebrated on May 8th. So this is the fundamental principles of the Red Cross. So it has 7 fundamental principles. So the Indian Red Cross Society also, we have our own Red Cross Society. It has about 1,100 branches all over the countries. So I have highlighted some of these in red so that these are the keywords that you can remember. So what does the Indian Red Cross Society do? It provides relief in times of disaster and emergencies and care of the vulnerable people and communities. So if anything happens, usually if you see what happens when we have floods, if we have cyclones, you will see the Red Cross emblem. There will always be one or the other few from the Red Cross Society. They will be there giving relief to these people who are suffering from these disasters or emergencies. So this is the history of the Red Cross. Okay. So the United Nations, another one is the United Nations Development Program, a development fund. This is also under the United Nations, and what it does is it provides funding to projects, especially to countries which are relatively poorer as compared to other countries, and they have their own member countries. Like here there are 170 countries. So it extends its services by giving the money, the budget that it gets, it allocates some of the budget to these countries which needs them in a fight to eradicate poverty and protecting the planet. Okay, but it extends its services only when that country asks for its help. If the country does not ask for its help, the UNDP will not do anything. Okay. So International Labour Organization is another organization. This, as the name suggests, it caters to the rights of the workers. Okay, it gives an equal voice to workers, employers, and governments. So under the International Labour Organization, we'll have labour laws, which is valid in all those countries which are part of the ILO. So this organization, it protects the rights of the labourers. Another organization is the Food and Agriculture Organization. This one, if we talk about international labor laws organization, remember the word labor, so it protects the rights of the laborers. And Food and Agriculture Organization, FAO, which is based, the headquarters is there in Italy, in Rome. It tries to provide food security in order to defeat hunger. Okay, so it provides food security to the member countries. So there are 194 member countries, and the staff under the FAO, they cater to these needs of these people. Okay. And the World Bank, have you heard of the World Bank? There are so many projects all over the world, health projects which are being funded by the World Bank. The World Bank is like, it gives loans to these countries to improve, okay, to work in a particular area of development. So it gives financial assistance in case if the countries want to tackle nutrition, if they want to tackle poverty, they can go to the World Bank and the World Bank will give this money. And the last organization is the USAID, the United Nations American Agency Fund. Okay. So it is specifically from the American people. So countries like America, these first world countries, since they are relatively more well-to-do than the third world countries, they set aside the money which they get from taxes from these people, they set aside for providing emergency aid to these countries who are in dire need of help, who are living in poverty, and who needs strong governance. Okay, so this agency, it provides funding to these countries who needs their help. Okay.